Okay, here we go. We are into the last chapters of 2016, next step. This is chapter 13, the eyes and the ears. This is a pretty short chapter. Same thing with anesthesia. These last two chapters aren't too bad. Again, kind of a little bit of wordy stuff. Some exam kind of criteria that you may or may not be familiar with. Okay, starting with case 13-1, and I'm holding my hand so it doesn't do all that stuff. I don't know. I'm not techie enough to know why or anyway. 13-1, this is a progress note, eye exam. The patient is considered a new patient because they haven't been in for 6 years. Anything after 3 years and a day is considered new, even if that patient's seen that doctor before. So this is going to be out of your medicine section, eye exam, and the patient has juvenile nuclear cataracts in both eyes. So that's your diagnosis code. Not too hard. 13-2. This is, again, a new patient, but it tells you they're new. They're for real new. They have a vitreous hemorrhage. They end up getting a intramuscular shot for pain or injection for pain, as well as an IV push. So you're going to have your exam. Your exam has an ultrasound component to it. Then you're going to have to go to your HCPCS and get the Toradol and the Diamox drugs that were given. And diagnosis-wise, this patient has a contusion or they injured the eyeball. And what did they do? I can't remember. I think, was this the one that we didn't know? Ultrasound. We know they're using ultrasound. There'll be an E-code. Oh, a bungee cord hit their eye. Yep. So that's what happened here. So you'll need a external cause code. Probably a Y code as well to put it location-wise, but your answers aren't going to have that. But I would do that. I would always have 2 external cause codes. In the real world, you're going to need what happened and then the place where it happened. Sometimes you even need the activity that you were doing, depending on if they were working or not, that kind of thing. Okay, a little bit of information about your cataracts. Again, here is the ECCE and the ICCE. You should have this labeled inside or within your CPT. I did talk a little bit about this on the partial number 2 mock board. We had a question with this, and I talked a little bit about it. So this should fill in any blanks if you still have them. 3A, senile cataracts. This is just a progress note for that. It's an established patient. Went into the office. It's outpatient. 13-4, senile cataracts. Extracapsular extraction. This is the op report for what's being done. Very, very straightforward. Eyes aren't too bad. A little bit of blurb about photocoagulation and how you, the diagnosis codes and that kind of stuff. 13-5, this is an eye examination, new patient. Patient has type 1 diabetes, and they have proliferative, or we're dealing with pre-proliferative diabetic retinopathy. Okay, so you'll have to find your diabetes combo code for that. 5B, remember overall your eyes do left and right. For them, this is a photocoagulation. Patient has type 1 diabetes with retinopathy. This is done just to the left eye. Here's that entropion and extropion that we had on partial board number 1. So it kind of helps you remember your HCPCS modifiers for your eyelids. 6A, entropion, extropion is being done. What kind of makes these difficult, and I can probably guarantee you'll have one of them on your board, is you have to really pay attention to your upper lids and your lower lids and which lid has what and what did they do to it. And then you have to keep track of all your modifiers for your lids. So I generally have to write it out. As I'm reading the scenario, I have to put, okay, left upper lid, blah, left lower lid, blah. And that's what helps me. Diagnosing wise, you're going to have your entropion and your extropion, and then this patient has Graves' disease as well. 13.7. This is a nasolacrimal duct. They're tear ducts. That's what they're working on here is the tear ducts. It's a 32-month-old. So this would be a congenital obstruction going on. So that's how I would look up that diagnosis. If they're only 32 months old and having tear duct issues, something congenital has happened. 8A, sore throat. This is a doctor's visit. They end up giving it, they don't have strep, but they do have impetigo. So you'll need 2 diagnosis codes, and they did do the rapid strep within the office, so you'll need that lab code. 8B, this is a well child. They're here for their well child check and a Head Start physical. So this exam is going to be a Z code, and it's going to be exam for preschool. Head Start's general, they're 4 years old. Obviously, this is preschool. And then they do have otitis media, serous. So I think you're going to find the serous sequence you to the non-suppurative or the non-pus, and you'll have to find that for the correct ear. Make sure on your ear infections you're doing left and rights. 13.9, these are pressure equalization tubes being removed on this patient. They were obstructed. It says that they've had recurrent infections and persistent fluid buildups. So here the PE tubes were removed with cup forceps. This was done in both ears, so you'll need a 50 modifier for bilateral. And then your diagnosis code here, they're having to be removed because of the recurrent infection. So that's going to be a complication, infection complication on those ears. 13.10. This is op note for a tonsillectomy, an adenoidectomy, and a myringotomy. So you're going to have 2 different CPT codes. You'll be able to find your tonsillectomy and your adenoidectomy as a combo code. And then your myringotomy, otomy is an incision in, myrin or myringo is the tympanic membrane. So they made an incision in the tympanic membrane bilaterally, both sides. So make sure that you're taking into account your bilaterals and all of that. From a diagnosing standpoint, you've got this chronic adenoid and tonsillitis, adenoiditis and tonsillitis. And you have a chronic otitis media, serous, and its chronic nature would be affecting both ears. So when you have to pick your left ear or your right ear, they did surgery on both of them for these diagnoses, so you can make the assumption that it's a bilateral problem. 13.11, tube removal. Impacted left PE or pressure equalization tube, removal of the impacted tube, and then placement of a new tube. Your diagnosis code here is going to be a mechanical complication. Can't remember exactly what happened here. I don't know, I can't read fast enough to get it, but they've removed the tube and replaced it. So common sense would tell you if they're replacing it, then there is some type of defect or issue with that tube. And I think it says something in here. Okay, 1312, myringotomy and tympanostomy. Myringotomy is the incision. Tympanostomy is a surgical created hole. This particular patient has nasolacrimal duct obstruction, so that's in their eyes. They have cerumen impaction in their ears. They have acute right otitis media with effusion and non-functional pressure equalization tubes. Holy cow. So we're going to have probably 3 CPT codes. So we're going to have to do the tympanostomy for the tube placement. They're going to have the cleaning out the left ear, that's yours. Left endoscopic nasal examination for a fracture. That's looking at that's the nose part, and then 1 is bilateral nasolacrimal duct dilation. So you're going to have your dilation, your tympanostomy, and that therapeutic nasal fracture that they did. Holy cow. How old is this person? They're going to be hurting. Oh, 10 years old. Holy cow. That's terrible. So you're going to have your congenital lacrimal duct obstruction for a diagnosis code, your cerumen impaction for a diagnosis code, otitis non-suppurative for a diagnosis code, and then the complication of the device for a diagnosis code. You've got a lot going on. Case 1313, this is a tympanoplasty. Remember, plasty is a surgical repair or a reconstruction. This is for conductive hearing loss. So you actually are going to have 2 different diagnosis codes. You're going to have this conductive hearing loss, and then you have the discontinuity of the ossicles within the ear. So just 1 CPT code. And that is it. This chapter was super fast.